Now, as the coronavirus outbreak continues to spread across the globe, a common public opinion is that the virus originated from a market in Wuhan in China from a pangolin. Scientists are trying to trace COVID-19 to its original source, and questions remain about how the virus was passed on to humans and from which species.
Dr. Andrew Peters, who is an associate professor in wildlife health and pathology at Charles Sturt University, says that it's not a matter of tracing the host species, but to determine how the virus jumped from animals to humans.
We can be pretty confident that originally it came from bats. We know that bats are the natural host for the SARS coronaviruses more broadly. I guess the remaining question is whether and what intermediate host it might have gone through. The SARS that emerged in 2002, the first version of SARS that we became aware of, went from bats to, it's thought to be the palm civet, so another intermediate host that then infected people. So there is some evidence that the pangolin is a possible intermediate host, but the evidence isn't quite there yet to conclusively say that that is the case.
Professor, there's also been a lot of talk about how that transmission actually transpired. There's been a lot of talk on the chat rooms that say this was through the consumption of this wild animal. Could you clear that up for us? How does the transmission then happen to humans?
Yeah, look, it's going to be very difficult to conclusively say exactly what event led to the transmission to occur, but certainly looking at other infectious diseases that have come from wildlife to humans, we do have a few clues. There are different routes that these viruses can be transmitted, including in urine and blood. So there are a number of different mechanisms that they can be transmitted. For instance, Ebola, which is another good example of an infectious disease that comes from wildlife. In fact, the majority of human new emerging infectious diseases come from wildlife. Ebola is thought to come mainly through, again, through urine and contact like that. HIV originally came through people butchering carcasses of primates, so really close blood-to-blood contact. What we do know is that there has to be pretty close contact between the original wild animal and humans, so it has to be a pretty recent and direct transmission, and most likely that's going to occur with live animals.
Are there lessons that we can learn from past examples where viruses have been transmitted from animals into humans that might help in this pandemic?
Yeah, absolutely. I mean, there's going to be intense focus on the wet markets in China as a focus for human spillover of viruses from wildlife, and that's rightfully so. I mean, they've been demonstrated to be a significant risk to new viruses emerging in people. But I think that the thing we mustn't lose sight of is that there are a whole lot of other things that we do in the natural environment that can lead to these kinds of spillovers occurring. And closer to home in Australia, we've seen a number of emerging infectious diseases, including Hendra virus, which is obviously a very well-known and deadly virus that infects horses and humans from bats. And the causes of that are thought to be deforestation on the coastal plain of Australia and the pressure that puts on bat populations as they move down to the coast in winter. Mm-hmm. So, we have to be a bit more broad-minded about all of the different types of things that can lead this to occur. And I think we have to basically just reconsider our relationship with the natural world, essentially, and try and work out where these spillover events come from more broadly and address that rather than focusing on just wet markets.
You know, Andrew, at the start of this particular outbreak, a lot of people were concerned that perhaps their pets might get infected with coronavirus. And we were assured by many experts that that could not happen, that it's only really a one-way traffic from animal to human. Now we're seeing a couple of animals in Hong Kong. I think there's an animal in Belgium, and we've just heard about this tiger in a Bronx zoo that's been infected with COVID-19 as well. Does this mean that the virus is mutating and going back into the animals?
No, the receptor that it binds to, so in order to infect an animal, including us, it has attachment proteins on its surface. And the receptor it binds to is common across all mammals. So it really comes down to how closely that can bind to that receptor. And what we know is that it does that very well for humans. That's why it's so infectious for humans. And what we know is that if animals are exposed to enough of this, some animals, so particularly cats and ferrets are another example, they can actually be infected. But the likelihood of them being infected is quite low compared to humans, it appears at this point. And also, they're not significant in terms of the transmission of the virus in the broader population sense. So that is really where a lot of the communication has been trying to minimize the concern people have, because in reality, our pets are not at very high likelihood of being infected. And the other thing is that they're not significant in terms of the transmission of it from human to human, as far as we know. So they're just, it's one of those things. There's so much coronavirus now out in the human population that it's not surprising that we are seeing some spillover events into some of our companion animals and other animals that we work with.